Well, today the president is isolating at the White House again after being diagnosed with COVID-19 and is, quote, doing just fine. That's according to White House COVID response coordinator Dr. Ashish Jha, who also said this morning the president's symptoms are mild, a runny nose, a dry cough, and basically those symptoms were the same as of last night.
For more on what we know of Biden's diagnosis, let's speak now to Dr. Jorge Rodriguez. He's a board-certified internal medicine specialist and viral researcher. He joins us now live. Doctor, good to have you.
Thank you, Jim.
I don't want to ask you to diagnose from afar, but wait, based on what we know here, Biden, 79-year-old man, he's vaccinated, boosted. I believe his most recent booster was in March. He's taking Paxlovid. White House releasing pictures of him still at work with mild symptoms. Based on what we know, what is the prognosis for someone with that kind of background and treatment?
Well, the prognosis, Jim, is that we need to be cautiously optimistic. President Biden has done all the right things. He's gotten vaccinated. He's gotten boosted twice. You know, the main thing going for, I think, President Biden is the fact that he is fit. He's trim. He doesn't have a history of diabetes or heart disease that we know about. And listen, people joke the fact that he fell off a bike. I'm so glad that he's able to ride a bike, which tells me that he is healthy. Otherwise, statistically, the one thing that is keeping, I think, his doctors watching very closely is the fact that he's over 60 or 65. And people that are of a greater age tend to get sicker and do a little worse.
So the fact that we learned yesterday, right when we learned his diagnosis, that he was going to go on Paxlovid, we've learned a little bit more since that he has stopped taking a few of his medications, like a cholesterol-lowering drug, a blood thinner. It's typical to stop those, right, when you take Paxlovid. I just wonder if you can speak to any concern over a Paxlovid rebound, something we know that Dr. Fauci had, for example.
Yeah.
How common is that? And obviously the benefit of Paxlovid, I guess, outweighs any risk of a rebound, right?
Absolutely. The benefit of Paxlovid, which is a combination of 3 medicines, some of which were HIV antiviral medicines, far outweighs the use of it. The rebound is only 2 to 7%, so therefore 93 to 98 times out of 100, you're going to do better and have less chance of getting hospitalized or have an emergency situation. The reason that some of those medications have been stopped now is the fact that some of the medicines in Paxlovid actually raise the levels of the other medicines in the bloodstream. So the better part of valor is to be cautious. You don't want someone to have blood that is way too thin. That could lead to a lot of other complications.
It strikes me that Biden's case, as we know it now, and the symptoms sound very similar to a lot of cases I've heard from family, friends, colleagues, mild symptoms, runny nose, sore throat. And again, we don't know what strain Biden has, but based on what we know about what strain is moving through the U.S. population now, is that generally what vaccinated and boosted people see if they do test positive for COVID?
Yeah, Jim, that is exactly what people see. And I would have to bet that this is the BA.5 strain. It's the one that's over 95% of the country. And even though the symptoms are more mild, and yes, they usually can be easily confused with a cold, sinus congestion, sore throat, you have to be careful because it's in the next 5 days or so that in some people, a rare number of people, that can turn into something a little bit more bronchial, a little bit more lung related. And we have to be cautious also for the next week or two that he may also have continued inflammation and coughing and things like that. But you're absolutely right. Those are the symptoms that usually happen nowadays.
A lot of things, as you said, working in his favor. Wishing him the best. Dr. Jorge Rodriguez, thanks very much.